What if the biggest downsides of all-on-4 implants wasn't necessary anymore? As the name suggests, that means all the teeth are on just 4 implants. All-on-4 implants is taking all the teeth out, or if somebody didn't have any teeth, having teeth be on just 4 implants. This was revolutionary because originally it was thought, man, maybe we need a single implant for every single tooth, which, as you can imagine, can be very expensive and very time-consuming. Well, all-on-4 really just changed the game. Absolutely revolutionary. The problem is, that was about 20 years ago. Today, things have changed dramatically. We have such better technology, we have such better techniques, we have such a greater understanding of dental implants in general. We know what makes them succeed, what makes them fail. The materials have advanced dramatically. These are all really important nuances that have changed the game when it comes to all-on-4 or all-on-X implants. So today, I refer to this as a full arch implants. That way, we're keeping the technique out of it. The tenets of all-on-4 surgery was removing a significant amount of bone to make an adequate amount of space for the materials that were available at the time. Well, what was the material that was available at the time? It was really acrylic dentures. So an all-on-4 was 4 implants, the patient's existing denture that the dentist would make holes in and then thread it over the implants. Now you have a fixed denture. So different from what we do at Dental Implants GPS today. Today at Dental Implants GPS, we never use acrylic, not ever. It's never a prosthetic that we give because it's such a weak prosthesis. And because it's so weak, the surgeons needed to make room physically for the thickness of that denture, which was very weak. That meant removing bone to give space for the denture. That is horrible. It's really awful to think that we might be sacrificing bone, your God-given bone, to make space for plastic. And fortunately today at Dental Implants GPS, that is just a thing of the past. We just don't do that. We focus on you and preserving your anatomy. We take a fiduciary responsibility to do the best thing for you. And that's certainly not what I would want for my own mouth, is bone removal. So today, what do? We still place 4, 5, 6 implants. It depends on you, depends on your situation. But we use materials that are incredibly strong and incredibly beautiful. And they don't need thickness to be strong. They're so strong even with thin teeth. And those thin teeth don't break. That material will help to protect your bone. The material matters and the surgical technique matters a whole lot. It really matters who your brain surgeon is. It really matters who your heart surgeon is. And it really matters who your oral surgeon is. To protect your bone, to go to somebody that really understands the anatomy and has a responsibility to you and feels that responsibility to protect your anatomy. I can't overemphasize how important this is. The patients that are having this procedure done are getting younger and younger over time. And we want to preserve this anatomy so that they can have all of their normal gum tissue, all of their normal bone anatomy for the rest of their lives. I'm doing one of these cases on a 24-year-old, somebody who struggled with methamphetamine abuse, and her teeth are destroyed. She has all her normal anatomy of bone and soft tissue, but her teeth are destroyed. Some clinics today even would just absolutely remove half of her jawbone, top and bottom, to make space for a denture that would sit on those implants. And it would feel like, oh great, I have teeth that don't come in and out. But what you don't know is that all that bone was removed, and completely unnecessarily. It's my responsibility to be that protector of your bone. Today we have this amazing coalescence of several factors. The first one, surgical technique. Advanced surgeons that do head and neck surgery, doing your implant surgery, a huge step up from what was done in the past. That's one. Number 2, incredible technology. Technology that allows us to plan the case down to the micron, 4 microns. That allows us to be incredibly precise with our digital technology and our surgical techniques. And the third one is the materials. The materials that we use are so incredibly strong that we can get really, really thin with the material and not have them break. They break way less than 1% of the time. Removing less bone is so important. Why? Well, because of the what ifs. We always want to have a backup plan. And what if your implants failed 10 years from now? What would you do? If the surgeon that you saw removed your bone, what would you do? So if you're looking around for all-on-4 dental implants or full arch dental implants or all-on-X dental implants, all these different names, we have a checklist down below for you. Click the link and you can get it. There's really important things in there. Not just where do I go? Is it the fastest? Is it the cheapest? But what's my surgeon's plan? What's their plan for me? We're gonna guide you with the questions that you should be asking your surgeon so that you know, is my bone being protected or am I going to a chop shop? Click the link for the checklist below so that you can get those answers.